Welcome back to Jersey Matters. I'm Larry Mendte. Seniors have been especially hard hit during this pandemic, begging the question, what can we do to better protect them? The AARP is on the case. Here's our interview with Evelyn Liebman, Director of Advocacy for AARP New Jersey. Thank you so much for joining us. I know that AARP New Jersey services all seniors in New Jersey, but at this time when we hear these nightmare stories coming out of nursing homes in New Jersey, I would imagine you have to be laser focused on not only helping seniors that are there right now, but how to protect seniors in the future now that some of these problems have been exposed.
Well, thanks, Larry, and thanks for having AARP on your show today. We are constantly providing information to our members, all older New Jerseyans, really all New Jerseyans, about any number of issues related to this health and fiscal crisis, from where to get help, where to file complaints, how to find out if you're eligible and can apply for the fiscal relief through the federal stimulus programs as well as state programs.
You have millions and millions of people that you represent, and so you have to care about all of them, especially in this pandemic, because they're all vulnerable. And yet much of your attention necessarily has to be played to the nightmare that's playing out in nursing homes and convalescent homes and retirement homes across the country.
Of course. Our nursing home residents are our most at-risk residents here in New Jersey and across the country. And as we have been witnessing in really heartbreaking and tragic detail, the impact that it is having on our nursing home residents, we have continued to advocate for those residents and to get information to their families about how they can advocate for their residents and get the information they need to make the best decisions possible for their loved ones and their families.
It seems the way that the patients are cared for and the way they're in there is not conducive, certainly, to a pandemic.
It is not a perfect system at all, and we once we get to the other side of this crisis, we all have a lot of work to do to make sure that this never happens again. Nursing homes in New Jersey and across the country have suffered from low staffing levels, from being understaffed. The problems that have come to light during this pandemic involve the lack of staff, but it also involves the lack of testing, the lack of PPE for nursing home staff, and a lack of oversight or independent eyes, if you will, that would typically be available under normal circumstances. So when the order came down that families couldn't visit to try and contain the spread of the virus, I think folks understood the rationale behind that. But at the same time, it was very hard then to see what was really going on. The state has suffered from a lack of inspectors. And so again, another lack of eyes on these facilities day to day. And then perhaps as heartbreaking are the constant stories from families that they can't get their phone calls answered, that they can't get information about their loved ones as the pandemic has been raging through these facilities.
So a lot of work has to be done to prepare for the next pandemic, because we know another pandemic will hit eventually. Are you going to push for legislation? Are you going to push for new rules?
We will certainly be working on that. That's a top priority for AARP New Jersey as we go forward. And as so many of our priorities have shifted as a result of this pandemic, we have to make sure that we put more care into our long-term care facilities. And that means ensuring that there are the appropriate staffing levels to assure that there is not just safe care, but that there is quality care. We need to improve our system of oversight and transparency so that we never find ourselves in a situation again where families can't talk to their loved ones, nobody answers their phone calls at a nursing home, And
in the case of Andover, they didn't even know that their loved ones had died.
Heartbreakingly, that is true, and that's not even the only nursing homes where we've had reports where families were unaware that their loved one had died or was even sick. And so much more work needs to be done. During this time, we've been providing families who have loved ones in nursing homes with information about the kinds of questions that they should be asking of the nursing home operators, including what precautions they are taking to separate residents who have tested positive from those who have not tested positive, including questions to ask about whether or not they're separating staff that work with those that are positive and those that are not. We're providing families with information about how they can reach out to the New Jersey Ombudsman's Office, which is an office here in New Jersey that represents nursing home residents, and also how they can contact the New Jersey Department of Health if they have complaints that need to be filed.
And the governor and the state has been responsive to all your needs?
Well, we early on were urging the governor and the Department of Health to publicly announce the names of the nursing home facilities that included residents testing positive. That's very important public health information. We were glad to see that I guess about 10 days ago or so, the state of New Jersey finally did begin to publish those names. We weren't asking for the names of individual residents, but it was important for families who weren't getting information, but also local public health officials to know where the outbreak of disease was happening in their local communities and in the nursing homes where their loved ones were living. And so we were glad to see that the administration has done that. We continue to urge the administration to establish a state-supported central point of contact for all families of nursing home residents as we continue to see families having trouble getting information about their loved ones at a particular nursing home.
Thank you so much for your time.
Thank you, Larry.
I hope we can talk again soon. That was Evelyn Liebman, Director of Advocacy for AARP New Jersey. When we come back, there's been a suggestion that New Jersey and other states file for bankruptcy. Is that a good idea? We'll take a closer look when Jersey Matters continues right after this.